Hey everybody, welcome back to the Tooth Doctor YouTube channel. My name is Trevor and this is the one and only Dr. Peter Yoo, the Tooth Doctor. And today we're going to be talking about what is endodontic treatment. George Bernard Shaw said, "The man with a toothache thinks everyone happy whose teeth are sound." And according to the American Association of Endodontists, more than 15 million root canals are performed every year. Oh. That's huge, right?
Yeah.
So, Dr. Yoo, tell us a little bit about a story you've had with a patient who needed treatment.
You know, one story that comes to mind is a man who understood the value of saving his teeth. He was in school, he had very little money, no benefits, came in with a toothache on a back molar, and I was like, okay, well, we can pull the tooth out for you. He's like, no. I don't want to pull the tooth. Right. Okay. So I was like, okay, well, I guess we can open it up. The cost to do just open up tooth and relieve the pressure and the pain is not a lot. And he's like, yeah, let's do that. So did that, got him feeling better, didn't see him for 6 months, saw him again. Toothache, still in school, no benefits, no money. So he's like, just do the same thing. I don't want to pull the tooth. Did it again. Finally, 6 months later, saw him again. Now different. Finished school, had benefits, had some money. He's like, you know what? Let's do the root canal. I want to keep my tooth. And he was happy for that. And I was actually quite impressed. I was like, wow, he's more of a believer than me. But that made me a believer, you know, just the importance of keeping your teeth.
That is an awesome story. So with that in mind, Dr. Yoo, what is endodontic treatment?
Well, your teeth are alive.
Okay.
They have nerves in there, there's blood vessels in there, and there's certain things, I won't go into too much detail of what your teeth do to help protect you, right? More kind of has to deal with like the sensitivity of teeth. Okay. Anyways, a root canal is basically when, unfortunately, bacteria or the tooth just somehow just dies. And, you know, so your body doesn't like, you know, things, you know, anything dead, anything that's germs, it's not part of the body. Your body wants to get rid of it.
Okay.
Okay. And so that's where you get infection, people get swelling, their faces get blown up, they get pain. You know, all that is because your body is actually trying to fight it off. But they can't. And so we have to, as dentists, we have to go in there and kind of basically clean out the tooth, hollow it out. I use kind of like the eggshell idea, right? Okay. You're pushing out the yolk, but you're holding on to the shell. So the tooth is that shell, and then you can keep tooth. You don't have to, you know, do anything else. And by doing that, you get rid of the pain, you get rid of the bacteria, and so the body doesn't react to the tooth, and then you can keep the tooth and still eat and chew and enjoy all the wonderful foods that you like.
Awesome. So what are the major benefits of getting a root canal or endodontic treatment?
Well, clear and simple, saving your teeth. You know, a lot of people, I met this very pretty lady when I was a dental student. And at the time, I think she was in her late 20s, but I looked at her records in her early 20s. She had all her teeth. And literally in about 5 years, I look at the chart, I'm like, what's going on? She had tooth pulled out here, tooth pulled here, tooth pulled. In her late 20s, she needed a denture. She needed 2 bridges. She actually needed to get a couple teeth with root canals. It was, for lack of better words, it was a mess.
Wow. And,
you know, like, I'm past my 20s, but, you know, like, just the idea of having to put something in and out of your mouth all the time, denture, it's not fun.
No.
So my always view is, you know what, save as many teeth as possible for as long as possible, right? And so, you know, your teeth are going to treat you well, and, you know, eating good foods and not have to, just cumbersome, you know, like, not to be rude.
Sure.
But, you know, when you wear glasses, like, if you didn't have to wear glasses, wouldn't everybody? Right? Obviously we wear glasses because we want to have good vision, stuff like that. But there are obviously issues with glasses. They fall off, they sometimes break, sometimes your kids pull them off your face. Yeah, so.
All the above?
Yeah. But, and that's what I mean. We want endodontic care, taking care of teeth, doing the root canal, basically saves the teeth and just allows you to have peace of mind.
Okay, that's awesome. So with that in mind, you recommend that it's better someone to save their tooth as opposed to pulling it out?
There's some times where in teeth, it's just not good,
Okay.
to the possibility of doing a root canal, the whole idea is it has to be fixable first.
Okay.
So if you have a big cavity and now it's hurting, aching, if that cavity is just too big, sometimes the better option is to take the tooth out because it's just too difficult to fix tooth, right?
Okay.
You try and fix it, but for certain somewhere down the road it's gonna come out or there's gonna be a big cavity. So, if it's a good tooth and it's fixable, we want to try and save it, right? The ones that are broken, sometimes they're broken off enough where they're, very deep.
Okay.
Those are the ones, unfortunately, you can't save, and it's better just to go with something else and other forms of treatment to fix the tooth.
Okay. So how painful is a root canal procedure? Is it like getting a cavity or is it a little bit more involved?
It's a little bit more invasive, and everyone's different. I won't say that root canals aren't painful. The very few are the ones we call hot teeth. For some reason, the infection will affect the area, and sometimes it doesn't allow the freezing to actually freeze the tooth.
Oh.
Okay.
Okay.
So when you go in, you touch and it's sensitive. And sometimes you need to stop, close it up, put the patient on antibiotics, get the infection settled down first, and then try and go back in. But most times, we give patients, I try and give, double the freezing just to make sure that it's nice and comfortable. But yeah, in general, a root canal shouldn't hurt. When you go in there and clean it out, sometimes sometimes the tooth inside is dead. So you can actually go in. I actually have told some patients, I'm going to fix this tooth without any freezing. They kind of look at me with wide eyes. But once I go in there, like, oh, you were in there already? And so, there is always balance. But just letting you know, root canals most times are usually comfortable. And it's just like getting a small filling done. Yes.
Okay. So how many appointments does it take to get a root canal done?
That's a little bit of a tricky question because it just depends on teeth. I've seen teeth in the front with sometimes 2-3 canals. Most times the back teeth they're a little bit trickier. There's more canals, so more cleaning that has to be done. It's like building a house or building an apartment. There's a little bit more work that's involved, and so sometimes appointments. If we can do it in one appointment, we can. But sometimes with infected teeth, or if it's a little bit more complicated, depending on anatomy, some people have really long teeth.
Yeah.
Some people have teeth where the roots are not straight; they're kind of curvy.
Oh.
That can be trickier. Yeah.
Wow. That sounds pretty intense.
Yeah, but we try and keep it to a minimum. Usually 2, maximum 3 appointments, unless there's something that. Some surprise or something issues, but we want to do our best. We want to do it so that it's done well and it doesn't get infected again, right?
Cool. Good to know. We're learning a lot today. So is there a long recovery period after you get a root canal?
Usually like the next day, it should feel better. I usually tell all my patients, with fillings or with root canals, once we're done, the freezing comes out, it can be a little bit sore.
Okay.
I actually give my patients my personal cell phone and tell them, hey, you know what? If you go home and it's really sore and just regular Advil or Tylenol's not helping, call me, and I'll come to the rescue.
Awesome.
Yeah.
Always good to know that you've got somebody that you can call
Yeah.
for some help when you need it.
Thanks.
That's great.
Yeah.
So is endodontic treatment or root canals, are they a permanent fix, or is there ever a time you got to go in and do something else with that tooth?
Root canals are permanent treatment. Yes.
Okay.
A lot of people, I've heard from some, it was a specialist. I was actually very surprised. The specialist said, root canals are temporary treatments to later pulling your teeth and getting implants.
Oh.
And I was like, So I went to a root canal specialist and asked, is that true? And the specialist says, oh, that specialist that said that, I actually treat their mother for root canals. So I'm not sure what the whole spiel is. Again, I'm not going to go into too much detail, but root canals are good and they are permanent treatment to try and save your teeth.
Okay. So this may be difficult to answer, but what is the typical cost of a root canal, or is it more expensive than other dental work?
You know what? Root canals, they're a little bit more, costly than filling per se, but they're cheaper than, for example, an implant. Okay, and that's the whole idea is, we kind of look at the cost benefit ratio in a sense. And so root canals can range, just depending on how many canals there are. They can range anywhere from, sometimes $500-600 to sometimes almost $1,500.
Okay.
So there is kind of a range, just depending on how many canals, how difficult it is. But yeah, in terms of the overall cost, we try and keep it in a range where, if you pulled a tooth out and you needed, let's say a bridge or an implant, it's actually going to cost way more. Some people are like, oh, I'll just pull a tooth out, put in a little denture. It's cheaper that way. I guess if you want to put something in and out of your mouth every single day.
Right. Yeah. Good. I for one, would want to keep as many teeth as possible in my mouth.
Yeah.
I know you would feel the same way. So what is the one thing that you wish every patient would understand about root canal treatments?
Root canal treatments. Well, one thing I'll say don't do is every time you have a toothache, don't walk into a dental office expecting that you're going to get or you're going to need a root canal. Okay? I always think simple things first. I have patients come in. I actually have a friend who actually lives about 3 hours away.
Okay.
Comes to see me, had a toothache, and said, Peter, if you can fix it, I want you to do it. So I looked at his tooth. I asked him a bunch of questions about what's going on, what happened, what caused it to get worse, what makes it feel better, all this stuff. And I looked at it and he goes, yeah, sometimes it hurts like a 10. I was like, okay. I looked at him. I said, oh. So I shaved his tooth, got the bite into the right place. Mm-hmm. I says, you know what? Let's see how this works. Call me tomorrow. He goes, that's it? Like, I'm in pain here. I was like, I know. This is what we're gonna do. Here's some painkillers to get the symptoms away. Call me tomorrow. He calls me tomorrow, goes, Peter, I don't know what you did, but my tooth doesn't hurt anymore. I saved him from doing a root canal, saved him from pulling a tooth. So a lot of times toothaches, yeah, they can be tricky. And I want to do what's best for my patients. Yes, if your face is swollen, that's usually a sign of infection. If your tooth is hurting and throbbing all the time, yeah, there's a very good chance there is something wrong. But again, different types of pains are causes for different things. Okay, like you have a noise in your car. Automatically, oh, I need a brand new car, right? Like yeah. Maybe there's a pebble, somewhere that's just knocking around or something like that, and you just have to maybe give the car a good wash or something like that. I don't know.
Yeah, simple fixes first are usually the best thing. And thank you so much for taking time with us today. Yeah. We appreciate it so much. And if you guys like what you heard, please subscribe to the channel. Thank you so much for spending time with us today, and we'll see you next time.